If I asked you to name a supplement that everyone has been taking lately, you'd probably say magnesium. Yes, in fact, magnesium is one of the 3 most commonly consumed supplements worldwide, along with vitamin D and omega-3. So can everyone use magnesium? Actually, the answer is a big no. We are very well aware of the people who should not use magnesium and the situations where the risk increases with magnesium use. Believe me, we also know very well the diseases related to elevated magnesium levels in the blood, which we call hypermagnesemia. So, magnesium might be a new topic for you, but for us, it's quite an old subject. So, who should not use magnesium? Who are the patient groups and healthy individuals who would put themselves at risk by using magnesium? If you fall into any of these groups, I do not recommend using magnesium. The video is starting. Here are the 5 groups. First, kidney failure. If your creatinine level is above 1.5, using magnesium carries a risk. If your creatinine level has risen above 1.5, it definitely means you have kidney failure. There is not a single patient whose creatinine level is above 1.5 but whose GFR level does not fall below 60. If the creatinine level is high, it means the kidneys are not able to filter creatinine sufficiently and it accumulates in the blood. One of the main functions of our kidneys is to remove excess magnesium from our body. One of the conditions we frequently encounter in kidney failure is hypermagnesemia. In other words, an increase of magnesium in our blood. As you know, magnesium supplements are actually salts. It is a magnesium salt formed by the combination of magnesium and an auxiliary substance in its structure. For example, magnesium malate, magnesium citrate, magnesium glycinate. All of these contain an auxiliary substance and elemental magnesium. If you're taking a total of 300 milligrams of supplement, probably 50 to 100 milligrams of that comes from the elemental magnesium part. So, by taking the supplement, you are actually getting elemental magnesium, and this can raise your blood magnesium levels even more. Do you know what happens if your blood magnesium level increases? When it goes above 2.5, the risks begin. If it goes above 3, sudden cardiac arrest and arrhythmias can occur. So if your kidneys are not functioning properly, please stay away from these magnesium supplements. Secondly, those with bradycardia and heart block. An increase in magnesium levels in the blood lowers the heart rate. We actually like this effect in cases of arrhythmia. Those with arrhythmias, those experiencing tachycardia, and those who frequently have premature beats can benefit from magnesium treatment. In fact, one of the treatments for a type of arrhythmia called ventricular tachycardia is magnesium. We administer magnesium intravenously and the person's arrhythmia may resolve. But if the pulse is low, if there is a block in the heart, meaning there is an interruption in the heart's electrical system, which can also be caused by magnesium, then it needs to be discontinued. If your pulse persistently stays below 55, or if you have one of the conditions we call heart block, we do not recommend using magnesium. Magnesium is just a supplement, a support, but if you use magnesium incorrectly, it can put your life at risk. In other words, you might put yourself in a risky situation when you were previously not at risk. Thirdly, those with low blood pressure. Magnesium is one of the supplements we frequently use in the treatment of hypertension. In fact, according to studies, magnesium can lower blood pressure almost like a medication. Using magnesium can reduce blood pressure by about 8 to 15 millimeters. However, in people with persistent low blood pressure and in those whose blood pressure drops to values like 80/50 and who frequently faint, magnesium may need to be discontinued. I said may be necessary here because the situation is not clear-cut. If your blood pressure tends to be low, please consult your doctor before taking magnesium supplements. After all, these are just supplements. Taking them is not of vital importance, but when your underlying illness and magnesium come together, the results can become critically important. It would be wise to seek advice before taking the risk. Thirdly, magnesium should not be used with certain groups of medications. For example, if you are going through a period of infection and frequently using antibiotics, you should pause magnesium supplementation during that time. Because magnesium can interact with medications. Again, some diuretics that we frequently prescribe for heart failure, which are heart medications. Diuretics actually work by removing magnesium from the blood. They lower magnesium levels by excreting magnesium through the kidneys. But some diuretics, which we frequently prescribe in heart failure, can actually increase magnesium levels in the blood. A diuretic that raises potassium levels in the blood can also raise magnesium levels. Again, as I mentioned, even when there is no high-risk situation, a risky condition may arise at that time due to drug-magnesium interaction. Another group of drugs is calcium channel blockers. When calcium channel blockers, which are blood pressure medications, are used together with magnesium, the drug-supplement interaction can cause blood pressure to drop excessively. Even though some of my patients use calcium channel blockers, I can prescribe magnesium to them, but for others I do not. It turns out it's quite important, isn't it? Magnesium is actually like a medication, and yet it's being consumed like a snack, isn't it? In fact, it can have side effects. So you are responsible for everything you put in your mouth. You can't just say, after all, it's just a supplement, and dismiss it. I recently shared studies with you showing that melatonin use increases the risk of heart failure and death. Use it only if there is a high likelihood that you will truly benefit from it, but if you have these conditions, do not use it. And the last point, people who should not use magnesium include those with certain intestinal diseases, such as inflammatory bowel diseases, Crohn's disease, ulcerative colitis, and other inflammatory bowel diseases. Especially in inflammatory bowel diseases that are accompanied by frequent diarrhea attacks, magnesium should not be used. Excessive or improper use of magnesium can interact with medications and the disease itself in these cases. I have patients with inflammatory bowel disease to whom I have prescribed magnesium supplements, but as I said, I make this decision by evaluating each case myself. You have inflammatory bowel disease, and without consulting a doctor or getting any advice about magnesium from a physician, you start taking magnesium directly. This is the wrong approach, but in this situation, I can't blame the public in general either, because sometimes even our doctors may not have sufficient knowledge about supplements. So people get confused in such cases. Should they use supplements or not? So what do? They turn to social media for help. They start expecting advice from people on social media who are not experts, whose qualifications are unclear, who aren't even doctors, or even if they are doctors, they don't follow the right approach and they do what those people say. They start using the magnesium those people are selling. It's not worth putting yourself at risk. If you're not sure, don't use it. If you have high expectations of benefit and you've consulted someone, then use it. It's as simple as that.